Your body often whispers before it shouts. A little more fatigue than usual. A little swelling in the ankles. A little dizziness when you stand up. After 60, these changes are easy to dismiss. You may think it is just aging, but sometimes a quiet symptom is the first clue that something deeper needs attention. In this video, you will learn 7 warning signs that adults over 60 should not ignore. Not because every symptom means something serious, but because new, unexplained, persistent, or worsening changes deserve respect. You will also learn which signs can wait for a routine medical visit and which ones may need urgent attention. Because the goal is not fear. It is recognizing a problem early enough to protect your health, strength, and independence. So, which quiet changes deserve attention first? Let's begin with 2 signs that many people blame on age: unusual breathlessness and swelling. The first is becoming short of breath during activities that were recently easy. You may need to pause while climbing stairs, carrying groceries, getting dressed, or walking across a room. One difficult day does not always mean something is wrong, but a new, unexplained, or worsening loss of stamina should not be dismissed. If you value calm, practical health information for life after 60, subscribe to Silent Health Triggers. We focus on the small changes that are easy to overlook. The second sign is new swelling in the feet or ankles. You may notice deep marks from your socks, shoes feeling tighter, or swelling that remains after resting. Temporary swelling can have simple explanations, but persistent or worsening swelling, especially when it appears with fatigue or shortness of breath, should be discussed with a healthcare professional. These symptoms can have several causes. The important clue is a clear change from what is normal for you. And if breathing becomes suddenly severe, especially with chest pressure, fainting, or confusion, contact emergency services immediately. Now, let's move to a different kind of warning sign. The third is sudden confusion, unusual trouble speaking, or words that come out wrong. This is not the kind of forgetfulness that happens when you misplace your glasses or lose a word for a moment. This is a clear change. A person may suddenly sound confused, struggle to form a sentence, slur words, or seem unable to understand what is being said. That kind of change needs urgent attention, especially if it happens with weakness, facial drooping, vision changes, or trouble walking. The fourth sign is unusual fatigue that does not match your routine. Everyone feels tired sometimes, but a clear drop in energy deserves attention when simple daily tasks begin to feel unusually heavy. You may feel worn out after getting dressed, preparing a meal, or doing activities that were recently manageable. Fatigue alone does not always point to one specific problem, but when it is new, unexplained, persistent, or getting worse, it should not be ignored. And when sudden confusion or speech trouble appears, do not wait to see if it passes. Seek urgent medical care. From sudden changes, we now move to 2 signs that often develop more quietly. The fifth is losing weight without trying. A smaller appetite may seem harmless at first, but if clothes become looser, meals are regularly left unfinished, or weight keeps dropping without a clear reason, the change deserves attention. Unplanned weight loss can happen for many reasons, including dental problems, medication effects, difficulty swallowing, digestive conditions, low mood, or other illnesses. The concern is not one missed meal. It is a continuing pattern. The 6th sign is new dizziness, balance trouble, or falling. You may feel unsteady after standing up. You may begin reaching for furniture, or turning your head may suddenly make the room feel unstable. These changes can be connected to dehydration, low blood pressure, medications, vision, weakness, or problems affecting the inner ear and nervous system. A fall is not always just an accident. Sometimes it is the first visible sign that something in the body has changed. Write down when the dizziness or imbalance happens and whether it began after a new medication. And if balance changes suddenly with weakness, speech trouble, facial drooping, or vision loss, seek emergency care immediately. The seventh warning sign is not one single symptom. It is any new, unexplained body change that continues or keeps returning. This may include blood in the urine or stool, unusual bruising or bleeding, a new lump, a sore that does not heal, a persistent cough or hoarse voice, difficulty swallowing, a change in bowel or bladder habits, or pain that repeatedly returns without a clear reason. Many of these changes can have harmless or treatable causes, but they should not be ignored when they are new, unexplained, persistent, or worsening. Embarrassment also causes some people to delay asking for help, but healthcare professionals routinely discuss bleeding, bowel changes, bladder symptoms, skin changes, and new lumps. The most useful rule is simple. If a body change is unfamiliar and does not go away, arrange a professional evaluation. And if bleeding is heavy, uncontrolled, or appears with fainting, severe weakness, chest pain, or breathing difficulty, seek urgent medical help. Now that you know the 7 warning signs, how do you decide whether a change deserves medical attention? Use 3 simple questions. First, is it new? Does it feel different from what is normal for you? Second, is it unexplained? Is there no clear reason for the change? Or does the symptom seem stronger than the apparent cause? Third, is it persistent or worsening? Does it continue, return repeatedly, or interfere with ordinary activities? A yes does not automatically mean something serious is happening, but it is a good reason to record the change and speak with a qualified healthcare professional. Write down when the symptom began, how often it happens, what makes it better or worse, and whether it appeared after a medication change. But some symptoms should not wait for an appointment. Call 911 or your local emergency number for severe breathing difficulty, chest pressure, sudden confusion, facial drooping, one-sided weakness, difficulty speaking, fainting, sudden vision loss, or bleeding that will not stop. The rule is simple. Gradual changes deserve attention. Sudden, severe changes deserve immediate action. Once you notice a warning sign, the next step is not to panic. It is to respond clearly. Write down when the change began, how often it happens, and whether it is improving or getting worse. Bring a complete list of your medications and supplements to your appointment. Do not stop prescribed treatment or begin a new supplement without professional guidance. Medical evaluation comes first, but daily habits can also support long-term health. Stay physically active at a level that is safe for you. Eat regular, balanced meals. Drink enough water unless your healthcare professional has advised fluid limits. Keep routine medical appointments, screenings, and medication reviews up to date. And manage conditions such as high blood pressure and diabetes with your healthcare team. Optional wellness resources may be listed below this video for viewers who want to explore additional support. These resources do not replace medical care, diagnosis, or prescribed treatment. The most useful action is always understanding the cause before trying to cover the symptom. So, what should you remember from these 7 warning signs? Do not judge a symptom by how small it appears. Ask whether it is new, unexplained, persistent, or getting worse. Most changes will not mean an emergency. But noticing a pattern early can help a healthcare professional identify the cause before it begins affecting your strength, safety, or independence. This video is for general educational purposes only. It does not provide a diagnosis and does not replace personalized medical advice, examination, or treatment from a qualified healthcare professional. Call emergency services for sudden severe breathing difficulty, chest pressure, fainting, uncontrolled bleeding, facial drooping, one-sided weakness, confusion, speech difficulty, or sudden vision loss. If this video helped you, subscribe to Silent Health Triggers. Here, we explain the quiet signals the body may give after 60, without fear, exaggeration, or miracle promises. And tell us in the comments, which of these warning signs surprised you most? Your answer may help someone else recognize an important change earlier. Listen to the quiet signs. Take action when something feels different. And we'll see you in the next video.